of Americans at some point in their lives. So today we have Dr. Alex Thomas with us. He's a neurosurgeon, and he's going to be talking about some of the common causes of back pain and when people should seek treatment and some of the new minimally invasive techniques for spinal surgery. So a lot to go over for you. Thanks for joining us. I appreciate it. Let's start first with some of the causes of back pain.
Well, as you said, back pain is a very common problem, and it's probably the most common complaint that I get in my clinic. I try to think of the age of the patient when I'm thinking about the cause. So in the younger patient, their 30s to 40s, when people first start having back pain, it's usually a muscle sprain. They lifted something wrong at work, or they did something they weren't supposed to in the gym. In their 50s or 60s, you start to see degenerative disc disease and arthritis, and you start to see symptoms from that. So people start to get the achy back pain in the middle of their back. It gets worse with activity, and sometimes it starts to go down their legs. And then as patients get older, those degenerative conditions get worse. The pain gets worse. You start to get pain from stenosis or instability. And finally, in the oldest patients, we always have to think about compression fractures from osteoporosis, especially in the older females.
So it really kind of changes
right, exactly.
as you age. And I've always thought, too, if you were injured in sports or anything like that, is that sort of perpetuated?
It can kind of start the degenerative process early. I kind of think of the degenerative process as a spectrum that kind of just moves along as you get older, and the only way to stop that is to not get older. So unfortunately, can't do that.
So aches and pains, you know, are common as well. But as you said, when you get older, things can sort of get a little bit harder to deal with. How do you know when to go and see somebody?
Well, you should come, first of all, your primary care physicians should try a trial of anti-inflammatories. I think the old prescription of bed rest is probably not the way to go. You should try to get active as soon as possible and get back to normal life. You should come to see a spine specialist like me when the pain's just not getting better. Or even worse, it's starting to radiate down your legs, or you're starting to have weakness in your legs, or more serious concerns like that. And then also, if you're having fevers, chills, night sweats, any unexplained weight loss, that could indicate something more serious, and you should come see me more quickly.
And what are some of the minimally invasive? I know people get really concerned about, you know, back surgeries and things like that.
So just about everybody that comes into my office knows somebody who had a horrendous outcome after spinal surgery. So I always have to talk to patients about that. But spinal surgery used to be very destructive with these long midline incisions. You'd have to strip the muscles and the ligaments off the spine, and patients often didn't get better or even got worse. So in the past 5 to 10 years, we've developed minimally invasive techniques where we can do even very large procedures through incisions that are less than 1 inch long.
I'm sure that'll make a lot of people very happy.
Right.